strongest mineral calcium. Right? Strongest mineral calcium. Calcium is always red along with phosphorus. Calcium is always red along with phosphorus because whatever compound we have in our body made up of calcium, it is nothing but a complex of calcium phosphate. Now, what is the complex which is found in our body made up of calcium? Bones, teeth, correct? So, these are all compounds of calcium phosphate, Ca3PO, P2, PO4, Ca3PO4 whole twice. Okay. Now, this calcium phosphate as such is not present. It is present in the form of hydroxyapatite. It is present in the form of hydroxyapatite. Okay. So, that makes the calcium phosphate, the compounds or the portions made up of calcium phosphate so strong. Otherwise, calcium phosphate is not so strong. Can you give me one example of calcium phosphate? Plaster of Paris, right? Calcium phosphate, right? But the calcium phosphate present in our body is a little bit different. It is hydroxyapatite, means it has got an extra molecule of water which is associated as a structural component of calcium phosphate. Now, calcium and phosphate, they are absorbed in the body if the ratio is around 2:1, the ratio around 2:1 in the diet, in the best possible way, right? In the bones, their deposition takes place if their ratio is around 3:1, right? So, that means we are absorbing calcium in the ratio of 2:1 and we are producing compound in the body with calcium and phosphate ratio 3:1. That means, are we increasing or decreasing the concentration of calcium? Increasing. So, there must be something which should help or must play a role to increase the concentration of calcium in the body. Okay? One such hormone is vitamin D, or vitamin is vitamin D. Vitamin, that's why it's called also a type of hormone. Right? Now, let us see what are the different forms of calcium present in our body. See, 99% of calcium is present in the form of skeletal structure, right? Only 1% is present in blood and other tissues. This 1%, we will come to that. Dietary requirement around 800 milligrams per day. We need not to worry about the calcium dietary intake if we take normal diet, right? Then why so many people are suffering from calcium vitamin E deficiency? You know, calcium deficiency is not a problem. Problem is vitamin D deficiency. As I told, calcium is best absorbed when the ratio of calcium and phosphate is what? Bolo? 2:1. But it is deposited in the bone when the ratio is 2 to 3. This journey they make through the presence of vitamin D. That's why a person shows vitamin D deficiency but not calcium deficiency in the blood. But they show deficiency of calcium in the bone. So, when we measure calcium in the blood, it decreases very small amount. But in the bone, the reflection comes in a massive way in case of vitamin D deficiency. Correct? So, whenever we assess a person's calcium status, we estimate two things, serum calcium and vitamin D. We must be sure that serum calcium is not that much, yes, it decreases, but it does not decrease so much with the absence of vitamin D. Rather, the calcium does not get deposited in the places where it has to be. Followed? So we should always take another parameter called ionized calcium into calculation. We'll come to that slowly. Fine. Now, what about the good sources? Do we take milk and milk products every day? No, not really. Being an adult of Eastern India, we are occasionally milk tolerant. That means mostly we are milk intolerant. So we rely on these vegetables, fish, meat, etc. Right? Absorption of calcium. See the region. This is duodenum and jejunum. First half of jejunum. Why it is important? Can anyone tell why it is important, this region? Suppose that portion of the intestine is surgically removed, the person has to be given calcium supplementation. But oral supplementation may not be sufficient to increase the calcium level. Right? Mechanism by simple diffusion and active transport involving calcium pump. If you can recall vitamin D, absorption of calcium, role of vitamin D in absorption of calcium in my last class. You have the diagram? Go to my last class, vitamin D. Ache? নেই তেমন তো পড়া হয়ে গেছে মুখস্থ হয়ে গেছে বলো তুমি বলো how vitamin D helps in calcium absorption. আরে এটা ক্লাস 12 এ কি বলবে calcium binding protein. Vitamin D helps in the synthesis of or upregulates the RNA producing calcium binding protein, right? By acting on DNA directly by VDR, vitamin D receptor. Vitamin D binds with VDR, the intercellular receptor for vitamin D. Then they together bind a portion of DNA where it upregulates the synthesis or transcription of mRNA, which is responsible for biosynthesis of or protein synthesis of calcium binding protein, or otherwise called calbindin. This calbindin binds free calcium inside the cell and thereby produces a gradient. Produces a gradient across the luminar surface of the mucosal cell. So calcium enters into the mucosal cell due to that gradient. And suppose inside the body there is no requirement of further calcium, then the CBP or calcium binding protein will remain saturated. Hence, it will not be able to take up more calcium, and hence the gradient will stop. So, no more calcium will enter. Clear? What are the factors that affect calcium absorption? Factors promoting calcium absorption means increase. What is the presence of vitamin D? Right? Number one. Number two, PTH, parathyroid glands. Can anyone tell me the location of parathyroid gland? Location of parathyroid gland. How many are there? এই উত্তরগুলো যে পারবে বলতে তার খুব একটা ক্যালিবার নয়, যে পারবে না তার ডিসক্রেডিটটা বেশি। কথা বুঝতে পেরেছিস? এটা বুঝতে হবে। বলো। হ্যাঁ, থাইরয়েড গ্ল্যান্ডের পিছনে হ্যাঁ কটা থাকে? কটা? চারটে। There are two pairs of parathyroid gland at the back of the thyroid gland, four corners. এটা পড়ার মধ্যে কোনো ক্রেডিট নাই, না পড়ার মধ্যে ডিসক্রেডিট আছে। কেন? ক্লাস 10-এ পড়ানো হয় এখন সিবিএসই বোর্ডে, তাই তো? না বললি? ইস কি অবস্থা, বল পড়া না। হ্যাঁ, তুই বেঙ্গল বোর্ডে ছিলিস? ও বাচ্চা ছেলে, ঠিক আছে। পিটিএইচ প্যারাথরমোন কি করে? প্যারাথরমোন ব্লাডে ক্যালসিয়ামের কনসেন্ট্রেশন বাড়ায়। ইট ইনক্রিজেস কনসেন্ট্রেশন অফ ক্যালসিয়াম ইন ব্লাড। ঠিক আছে, কোথা থেকে বাড়ায়? কি করে? ভিটামিন ডি কি করে? অ্যাবজর্পশন বাড়ায় ক্যালসিয়ামের, ফল হিসেবে অ্যাজ এ রেজাল্ট সিরাম ক্যালসিয়াম লেভেল বাড়ে। পিটিএইচ কি করে? ভিটামিন ডি সিনথেসিস বাড়ায়। কোথায়? অ্যাট কিডনিস। কিডনিতে 1-alpha hydroxylase বলে এনজাইম আছে। কি আছে? 1-alpha hydroxylase, which is the final step or biosynthetic step of vitamin D biosynthesis. That is stimulated by PTH. হলো? PTH এর মজা হচ্ছে ক্যালসিয়াম এবং ফসফরাসের উপরে এর একটা কন্ট্রা রেগুলেশন আছে। PTH যদি বেড়ে যায় তাহলে কি হবে? Hypercalcemia and hypophosphatemia. PTH যদি বেড়ে যায়, in case of increased PTH, there is hypercalcemia. কেন? Is it only due to increased synthesis of vitamin D? No. PTH will help in excretion of phosphate. So what will happen? The calcium will not be able to get deposited because the phosphate ratio is decreasing. So the extra calcium will come into the blood. It will not get deposited in the bone. So at the cost of bone resorption, PTH will increase the blood calcium level. Why? Why at the cost of bone? Because if you suffer from fracture, you will survive. But if you suffer from cardiac arrest, will you? So if the serum calcium level goes low, you will suffer from cardiac arrest. If serum calcium level goes high, you will suffer from same cardiac arrest. So it has to be maintained in a very small region. 9 to 11 milligram percent. Correct? In very few cases, rare cases, it is seen to be very elevated, around 24, 25 milligram percent serum calcium level. That is mostly associated with some sort of carcinoma. In a normal person, if you inject ionized calcium, intravenously, immediately he will suffer from cardiac arrest and he will die. That is one of the way you can earn your paternal or maternal property by obviating the actual heir. বাংলায় বললে বাবা মাকে খুন করে সম্পত্তি পাওয়া সহজ উপায়, তাই না? অনেক দেখবে ইয়েতে তোমরা ডিটেকটিভ গল্পে দেখবে সিরাম ক্যালসিয়াম ইনজেকশন দিয়ে মারা হয়েছে, সেই ক্ষেত্রে পোস্টমর্টেমে ইনজেকশনের চিহ্ন পাওয়া যায়, তাই না? ফাইন। Low acidity means low pH, high acidity, low pH is favorable. Lactose, দুধ খেলে ক্যালসিয়াম পাওয়া যায়, কোথায় বলেছে? টিভির অ্যাডে বলে না দুধ খেলে ক্যালসিয়াম পাওয়া যায়, কিন্তু খালি দুধ খেলে হবে? খোকা তো বাড়ছে, তাই কি দিতে হবে? ফুড সাপ্লিমেন্ট, তাই না? আজ ওর ফুড সাপ্লিমেন্টে এত ক্যালসিয়াম রয়েছে যে খোকা খেয়ে একবারে ওখান থেকে আর্নল্ড শোয়ারজেনেগার হয়ে যাবে, তাই না? ভুল, কিছু হয় না। লাইসিন অ্যান্ড আর্জিনিন ফেসিলিটেট ক্যালসিয়াম অ্যাবজর্পশন। কেন? এটা কি? বেসিক অ্যামাইনো অ্যাসিড এরা ক্যালসিয়াম অ্যাবজর্পশনে সাহায্য করে, যে হেল্প ইন ক্যালসিয়াম অ্যাবজর্পশন। লাইসিন আর্জিনিন কিসে পাওয়া যায়? মিট সোর্স, মিট। ফ্যাক্টরস দ্যাট ইনহিবিট ক্যালসিয়াম অ্যাবজর্পশন, খুব ভালো করে এটা এই স্লাইডটা দেখবে। মেনি মিনারেলস হ্যাভ সিমিলার এফেক্টস like this calcium. কতগুলো টার্মিনোলজি তোমার এখানে আসবে, যেমন অক্সালেট, ফাইটেট ইত্যাদি ইত্যাদি, তাই না? এখানে কি দেওয়া আছে? ফাইটেট অ্যান্ড অক্সালেট। ফাইটেট কোথায় পাওয়া যায়? ফাইটো মানে প্লান্ট, তার মানে প্লান্টের যে বড় বড় অর্গানিক অ্যাসিডগুলো থাকে তাকে বলা হয় ফাইটিক অ্যাসিড বা ফাইটানিক অ্যাসিড, ঠিক আছে? ফাইটানিক অ্যাসিড। ক্যালসিয়াম এই ফাইটেটের সঙ্গে রিয়াক্ট করে ক্যালসিয়াম ফাইটেট তৈরি করে, which becomes insoluble, so it precipitates calcium. Unless in free form it will not be absorbed. Okay, ফাইটেট কিছু থাকে বেশি? ভেজিটেবলস, ঠিক আছে? Now we come to oxalates. অক্সালেট কোথায় থাকে? একটা ভেজিটেবলের নাম করে যেমন অক্সালেট থাকে, যেমন টমেটো। আর পালসেস, ডালের মধ্যে প্রচুর পরিমাণে অক্সালেট থাকে। সেম অক্সালেট precipitates calcium and thereby reduces calcium absorption. Because of this reason, calcium tablets are advised to be taken at empty stomach. Calcium tablets are advised to be taken at in empty stomach. And similarly, same for iron tablets. Because same phytate and oxalate, they precipitate. What else? Calcium is a bivalent metal. So, do you think other bivalent metals might interfere? Yes. Other bivalent metal means if it is iron, no issue. Why? calcium and iron both are required. But if it is zinc, if it is manganese, then we don't need zinc and manganese in that huge amount like we require iron or calcium. So in that case, zinc and magnesium, if present in high concentration, then it will be absorbed at less concentration. Which one? Calcium will interfere. One more thing, phosphate. What if we consume more phosphate? Will there be more absorption of calcium? Food substance which contains highest phosphate, highest amount of phosphate. The phosphate is so high that it can be used for cleaning utensils or even commodes. Yes, soft drinks. It is so harmful. It reduces calcium absorption drastically. And if you consume, say for example, 10 to 15 years daily, then a good amount of soft drinks, you are supposed to have osteoporosis. Okay? So that is a greatest concern among the young adults. Free fatty acid react with calcium to form insoluble soaps. Salts are soaps, so they do not get absorbed. Correct? 2:1, it is the alkaline condition or high pH is unfavorable. High content of dietary fiber interferes with calcium absorption. Why? It contains phytate. Low estrogen level. After menopause, estrogen level goes down. So, very often these adult females, they suffer from calcium deficiency, osteoporosis, which can easily be corrected by vitamin D and calcium supplementation. Calcium should not be supplemented alone. It should always be supplemented with vitamin D. Correct? True? Problem is there. Nowadays, the government of India has issued advisory or orders to separate these drugs. Means vitamin D should be available separately, calcium should be available separately. Why? Because in some patients, they do not require vitamin D because their dietary habit is such that calcium is absorbed less. So they need only calcium at high concentration. That's all. They do not need vitamin D. Correct? So nowadays, you might find calcium and vitamin D as separate components. Any questions so far? Plasma calcium. বলো। হ্যাঁ, usually vitamin D helps in synthesis of calcium binding protein and that helps in the absorption of calcium from the gut. Now, in very few patients, you find that the supplement is required for only calcium, but not only vitamin D. Vitamin D is sufficient. Okay, suppose he is taking vitamin D containing food more, oily food more, but less food which contains calcium. So, for example, he is taking a lot of fried food. Correct? Now, this fried food is tasty? What makes a Kentucky Fried Chicken tastier than the normal chicken curry? Coating is made up of maida only, flour. Presence of a secret ingredient discovered by that old fellow, Kentucky fellow. What is the secret ingredient? Mostly, or most probably, I don't know the actual name, but these secret ingredients are nothing but free fatty acids or free amino acids, which are used as taste enhancers in hotel industry. Their secret agent means they are nothing but free fatty acids. If you give free fatty acid more, then it will be tastier. If you give free amino acids more, it will be tastier. But what will happen if there is a lot of free fatty acid then? Right? Moreover, Kentucky Fried Chicken is always comes with what? Not alcohol. Cold drinks, Pepsi, Coca-Cola, something like that. So that will reduce further. Now, this part is important. The normal level of calcium in plasma is between 9 to 11 milligram %. Sometimes, if you go to USMLE, something like that, you need to remember these figures because there they use SI unit. Okay? How do you get it? Divide by what? The molecular weight of calcium, and this is milligram %, 100 ml. So multiply by 10. So divide by 40, multiply by 10. So you get this. That means divide by 4. So divide 9 by 4. See how much you get? আরে দেখ এখানে লেখা আছে 2.25. I am telling you how do you convert. How do you convert these figures? Once you know, you need not to mug up all the figures. Suppose if I ask you, what is the normal level of blood glucose, fasting blood glucose in SI unit? How do you figure it out? বল তখন তো ঠ্যাংলা আছিস নর্মাল কত 70 70 থেকে 100 তাই তো তাহলে 70 হলে কত হবে এসআই ইউনিটে 100 হলে কত হবে কিভাবে করবি বল জোরে বল গ্রামে তো এতক্ষণ যে আমি বললাম কিছু শুনিসনি তুই বল মিলিগ্রাম থেকে মিলিমোলস পার লিটার নেক্সট 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 কে পারবে নেক্সট পারবি বল ডিভাইড বাই 180 ইন্টু 10 কত হবে বল কর ক্যালকুলেটর নে মোবাইল নে 70 আর 100 কত হ্যাঁ 3.8 আর 100 হলে 5.5 হ্যাঁ so this is how you remember. Suppose in case of sodium potassium chloride, for sodium এই যে বস বস, তোর বেস্ট ফ্রেন্ড নাকি? বেস্ট ফ্রেন্ড? ওর গায়ে কোনো প্রশ্ন আসার আগে আমি ঢাল হয়ে দাঁড়াবো নাকি? হ্যাঁ, ওকে মারার আগে আমাকে মারতে হবে? হ্যাঁ বল। সোডিয়াম নর্মাল লেভেল 135 মিলি ইকুইভ্যালেন্ট পার লিটার। এসআই ইউনিট কত হবে? কি করবি? হ্যাঁ, কে পারবে? একই থাকবে, মিলি ইকুইভ্যালেন্ট পার লিটার ইজ অ্যান এসআই ইউনিট। গুগলি ছিল এটা। Keep your brain working. You may not work, but keep your brain working. বুঝছো? বোকা বোকা দেখা, কিন্তু বোকা হয়ে যাস না, ব্রেনটা যেন কাজ করে। হলো আয়নাইজ ক্যালসিয়াম মানে ডিফিউজিবল ক্যালসিয়াম, যেটা ইট ক্যান বি এক্সচেঞ্জড বাই টিস্যু, তাই না? তাহলে ডিফিউজিবল ক্যালসিয়াম আমরা যদি মাপতে চাই তাহলে কি মাপবো? আয়নাইজ ক্যালসিয়াম মাপবো। কি হয়? অ্যাবাউট 50% ionized form which function is the most active. তার মানে ও যদি 9 থেকে 11 মিলিগ্রাম থাকে, তার মানে তার 50% আয়নাইজ থাকবে, তাই তো? কমপ্লেক্স ক্যালসিয়াম উইথ অর্গানিক অ্যাসিড 10% ক্যালসিয়াম ফসফেট, ক্যালসিয়াম অক্সালেট এরকম ভাবে থাকবে। আর কিছু থাকবে প্রোটিন বাউন্ড 40%, 50, 40 আর 10% থাকবে। এই যে 50 আর এই 10 এটা ডিফিউজেবল আর এটা নন ডিফিউজেবল, তার মানে কত? 60%। এবার একটা ক্যালকুলেশন বলি, লিখে রাখো, রাইট ডাউন। Ionized calcium is measured using ion selective electrode. Ionized calcium is measured using ion selective electrode, similar to sodium, potassium and chloride estimation. Correct? The ionized calcium result is X in instrument. Instrument result is X. Okay. So the actual will be 4 into X, ionized calcium. Total calcium will be 8 into X. কেন? আয়নাইজড ক্যালসিয়াম কত? 50%, তাই টোটাল ক্যালসিয়াম কত হবে? তার ডাবল। কিন্তু আমরা মাপবো কোনটা? তার কম, তাই না? Ideally it is 7.8, but if we multiply the ionized calcium by 8, roughly you will get serum calcium level. The method used for estimation of serum calcium is completely different from that of the method used for estimation of ionized calcium. All I wanted to convey this. Correct? So the values will be different for the same person, same sample. What is the interrelationship? Now you know. If you are given a person having ionized calcium machine result 1.2, that means he has free calcium how much? 1.2 into 4, 4.8. That means total calcium how much? 4.8 into 2 means how much? All right, this you remember. Okay, Factors regulating plasma calcium level. Very, very important. Very, very important. Correct? Suppose it starts to fall, means decreasing serum calcium level. What will happen? It will stimulate parathyroid gland and PTH secretion will be more. PTH will increase vitamin D production. Vitamin D will stimulate calcium absorption. Correct? Huh? Now, এটা হয়ে গেল। So calcium absorption, increased calcium absorption increases serum calcium level. Done? It's not so easy. Anyway, keep this with view of PTH. Vitamin D we have discussed earlier. We'll discuss again. Now, we start the story from this side. Huh? Increased it will increase calcitonin secretion. From where? Thyroid gland, again thyroid gland. Calcitonin directly will increase the excretion of calcium. As a result, একটা diagram, দুটো হলো, এটা মনে থাকবে, ইজি। হ্যাঁ, এবার ব্যাপার হচ্ছে, now we make the things more complicated because it is not so easy. Because from where we'll get calcium in the body? From bones. So if you are excreting calcium, which part will be weaker? Bones. So calcitonin will withdraw calcium. Calcitonin will withdraw calcium from bones in order to excrete. Calcium will be excreted, bones will be weaker. Correct? Parathyroid hormone will again take up the calcium from the bone, it will excrete the phosphate and calcium will go to blood. Calcitonin will excrete the calcium. PTH will excrete phosphate, and in absence of phosphate, calcium will not be able to get deposited in the bone, so the calcium will go to blood. Good. Vitamin D will increase the calcium absorption, but again it will withdraw the calcium from the blood in order to make bones. So only vitamin D will help in bone formation, nothing else. Rest all will make the bones weaker. হলো? তাহলে ভিটামিন ডি প্রেজেন্সে বোন স্ট্রং হবে, বোন ফর্মেশনে হেল্প করবে। কিভাবে হেল্প করবে? তিনটে ভাবে। এক, ক্যালসিয়ামের কনসেন্ট্রেশন বাড়াবে 2:1 থেকে 3:1। দুই, অস্টিওক্যালসিন বলে একটা প্রোটিন আছে, তার সিনথেসিস বাড়ায়, which helps vitamin D increases synthesis of osteocalcin, which increases or which helps in concentrating calcium near the bone. Number three, it increases osteoblastic activity. Osteoblastic activity is very difficult to understand. It's very interesting, as you say. There are two types of bones, osteoclasts and osteoblasts. What are the difference? Osteoblast like you, osteoclast like me. You are still growing and I am not any further, right? Is it that so? Right? But here osteoblast is something which maintains a dynamic state, or osteoclast is something which is not in a dynamic state. Means if the door is open, you can enter as well as exit. Correct? Osteoclast is something, the door, with the irrespective of the status of the door, it is open or closed, doesn't matter, we cannot go outside. Means neither we form a new bone nor we give away the calcium when needed by the blood. That is osteoclast. But we need osteoblasts so that when required we can synthesize bone, when required we can withdraw calcium from the bone and supply to plasma, otherwise we will have cardiac arrest. That is why osteoblastic activity is a dynamic state for bone formation. There are two words called bone formation or mineralization, and it is called bone resorption or bone demineralization. Correct? Vitamin D helps in mineralization of bone by increasing, number one, calcium concentration, osteocalcin synthesis and osteoblastic activity. Okay? That's all. Right? PTH সম্বন্ধে লেওয়া আছে, দরকার নেই এগুলি, দরকার আছে এগুলি, দরকার নেই। এটা যখন হরমোন পড়বে তখন দেখে নিই। Osteoblast, osteoclast. Okay? আচ্ছা, এটা তাড়াতাড়ি শেষ করি। এটা এটা আমি অলরেডি করে দিয়েছি এখানে। সহজ, তাই তো? ডেফিসিয়েন্সি ম্যানিফেস্টেশন অফ ক্যালসিয়াম ডেফিসিয়েন্সি কি হবে? For children, for adults, osteomalacia. Why not osteoporosis? Which one is correct? Osteomalacia or which one? Osteoporosis? Osteomalacia. Right. Osteomalacia is the correct one. Right. So dietary deficiency of calcium and phosphate. You give him good food, he will become stronger. Will he? Not always, but slightly. How do you know that? Bony necklace means the costochondral joints will become prominent. Costochondral joint means the cartilages joining the ribs or costocolumnar joint. So it will look like as if as a necklace. It will become prominent. Since the bones are very soft, so what will happen? Our chest shape is like a barrel, means from front and back it is compressed, and sidewise it is broader. But in this case, because their ribs are very soft, when the lungs will go up and down, their chest will be like a pigeon, like bird's chest, means front and back will be longer than the sides. Understood? What is the difference? From top view, if we see, this is our chest, human chest, and this is the chest of a bird, pigeon. Normally, our chest is like this, but in case of vitamin D or calcium deficiency, the chest will be like a pigeon. So, pigeon chest. Right? What else? We can take, see the load bearing bones are bent. If they bend outwardly, we call it bow legs, like a bow. If they bend inwardly, we call it knock knee, like this. What else? The patient may not come with these severe symptoms. Patient may not come up with these very severe symptoms. But how you know? A simple radiological examination, a simple X-ray of hand of the patient. Patient means pediatric patients, children. Hand, হাতের একটা X-ray করো, পরিষ্কার ধরা যাবে ক্যালসিয়াম ডেফিসিয়েন্সি আছে বা ভিটামিন ডি ডেফিসিয়েন্সি আছে। আচ্ছা, toxicity. If calcium is more, what will happen? Kidney stones. Which part of India suffer most from kidney stones? Can anyone tell me? The part of India who consumes a lot of sour food, sambar, rasam, and lots of tomatoes and chilies, full of calcium and oxalate. Right? So what will happen? If they drink less water, it will get deposited in the kidney in the form of stone. But if they drink more water, eventually it will go off. Right? Huh? Is there anyone from South India? Huh? No. Acha kyo?